I am Dr. Vyjayanthi. I head the fertility services at KIMS Fertility Center at Krishna Institute of Medical Sciences. I have done my training in reproductive medicine and surgery at two of the world's largest medical units in the UK, the Leeds Reproductive Medicine Unit and St. Bartholomew's Hospital in London, where I did my subspecialty fellowship. It is 7 years since I have returned to India and practicing here. Today I will talk about certain myths and facts related to infertility. Problem of infertility is still not openly addressed in our society. However, infertility can be a devastating experience which can change every aspect of a couple's life. Indeed, there are very few medical problems which can so profoundly affect the health of a person as infertility. However, it is important to remember that infertility can be treatable. Having a basic knowledge about fertility issues is the best way to take that first step towards prevention, and if faced with the problem, to take medical help. So, what is infertility? Infertility, according to medical terms, is inability to achieve a pregnancy after trying for an year. Why is this prescribed time limit of 1 year? Usually about 85% of the couples are successful in achieving a pregnancy by the end of 1 year. Another 4 to 5% of the couples are successful during the course of second year in achieving a pregnancy. So, it is important to take medical help if a couple have not been able to achieve a pregnancy by the end of 1 year. However, if there are certain issues such as irregular cycles in the women which are indicative of ovulatory disturbances, or if the female age is 35 years or more, it is important to take medical help earlier than the prescribed time limit of 1 year. How commonly do we see these infertility issues? It is a very common problem affecting 1 in 6 couples. Next, infertility is mainly considered as a female problem. It is a myth that infertility is only a female problem. It is important to know that in 1/3 of the couples, the infertility is primarily due to a female factor. In another 1/3 of the couples, infertility is primarily due to a male factor, and in the rest 1/3 of the cases, there are both the male and the female factor contributing to the problem of subfertility. Having seen what is infertility, how common is the problem, and it is not primarily a women's problem, I will move on to discuss what are the common causes of infertility, how we go about evaluating the couple and treating them. It is important to remember that in the modern infertility treatment, we focus on the couple together, and so it is extremely important that both the male and the female partner are evaluated in an infertility workup. It is also important to remember that couples seeking fertility treatment are ideally treated by a specialist team, as this improves the efficiency and the effectiveness of the treatment, and this also has been shown to improve patient satisfaction. The common causes of infertility in the female are what we call as ovulatory disturbances, where there are problems with ovulation. In some of them, it could be because of a tubal block, and there is also a medical condition called endometriosis, which also causes female subfertility. And in urban areas, we also see what is called as age related subfertility issues. Usually women do delay childbearing and marriage due to career issues, and this could lead to what is called age related decline in fertility. Once a woman hits 35, the fertility declines dramatically, and more so when they reach 40, and this is one of the reasons contributing to female causes of subfertility. Coming to male subfertility, some of the common causes are usually a low count or a low motility contributing to the problem. When a couple present to us for evaluation and treatment, some of the basic tests which we would do for the male would be a semen analysis, and if it is abnormal, we follow it up with hormonal tests. When it comes to the female, the tests which we usually offer are the hormonal tests, tests to check for ovulation, check to test if the tubes are blocked or not, which is done either in the form of an X-ray called HSG or as a keyhole surgery called laparoscopy. So, once problems are identified, then we move on to the treatment aspect. So, treatment is mainly focused on identifying the problem and focusing the treatment towards the problem. Some of the common treatment options in the female, for instance, are if the woman has got ovulatory disturbances, we offer tablets which is called ovulation induction treatment, and if there is a tubal blockage, the treatment is either the form of what we call tubal surgery or IVF, IVF stands for in vitro fertilization or test tube baby. When a woman has got endometriosis, in milder cases we offer a treatment called IUI or intrauterine insemination, and in severe cases IVF. When it comes to the male, the treatment options are either what we call as intrauterine insemination, or in severe cases of male factor either IVF or ICSI, intracytoplasmic sperm injection. So, having discussed about the causes of infertility, how to evaluate and the treatment options, I would like to discuss with you about how successful is fertility treatment. It is important to remember that the diagnosis of infertility does not necessarily mean childlessness, it just means that it is a challenge which needs medical help. With the recent advances in the treatment for both the male and the female, and with the advent of ART or assisted reproductive techniques such as IVF and ICSI, we have been able to help a vast majority of the couples who present to us for fertility treatment. We can confidently say that we are able to help more than 9 out of 10 couples who come to us for fertility treatment to achieve a pregnancy over a period of time. To conclude, we have today seen as to what is infertility, how common is the problem, what are the common causes of infertility, and that it is not primarily a women's problem, and that the diagnosis of infertility does not necessarily mean childlessness, and a vast majority of the couples are successful in achieving a pregnancy over a period of time. Thank you.